So let us look at some of the few blood products. What is cryoprecipitate? Okay, let us go in sequence. First, let us see what is whole blood. In whole blood, nothing has been removed. So no contents removed. So it contains RBCs, WBCs, platelets, plasma. What are the indications? The indications are acute massive bleeding, open heart surgery, and neonatal total exchange. Now, blood, common sense that blood is a very scarce resource, right? You cannot waste blood and you should only use what is required. Now, a whole blood contains RBCs, WBCs, platelets, and plasma. Now, a patient might not require all these components. That is why whole blood is not routinely used. It has specific indications only. You have something called packed red blood cells. Now, these packed red blood cells, they contain RBCs with variable WBCs and small amount of plasma. Okay, this is what is routinely used. So suppose whenever you are going to transfuse blood, especially in perioperative conditions, this is what is routinely used in wards. This will increase the hemoglobin by 1 gram per deciliter and it will increase the hematocrit by 3%. Next, we have something called platelets. So this is, you would have seen that this is being given in dengue patients. Platelets contain 5.5 into 10 to the power 10 platelets in a random donor unit. So when you are using random donors, you're going to get this quantity of platelets. So one platelet transfusion will increase the platelets by 5 to 10,000. So the normal platelet count is each 1.5 to 4.5 lakhs. If you give 1 unit of platelets by a random donor, it is going to give you 5,000 to 10,000 platelets will be in the increase in size. Next, you have something called fresh frozen plasma. So fresh frozen plasma, it contains plasma proteins. So you would have noticed while doing your internship that whenever a patient has hypoalbuminemia or hypoproteinemia and the patient is in ICU setting or in the wards maybe, because albumin is expensive, so we might give fresh frozen plasma, because fresh frozen plasma, it contains plasma proteins. It contains certain coagulation factors such as protein C, protein S, and antithrombin. All right. Next, so this fresh frozen plasma, I forgot to mention, it will increase the coagulation factors by approximately 2%. Lastly, you have cryoprecipitate, and like I told you, precipitate factor 8. So it contains factor 8. It contains von Willebrand factor. It also contains fibrinogen. Okay, now moving on. How do you store these blood components? So you can store these blood components in anticoagulants. You can use anticoagulants, and that will also have a storage duration. So the anticoagulants that are used are acid citrate dextrose, citrate phosphate dextrose. Okay, this has you store the blood for 21 days. Then there is something called SCPDA. This is citrate phosphate dextrose adenine. This you can store the blood for 35 days. Then you have something called SAGM. This contains saline, that is normal saline, adenine, glucose, and mannitol. This is the best because you can store the blood highest for 42 days. Now, what is the role of all these contents? So, if you give glucose, there can be ATP generation by glycolysis. If you give adenine, adenine is a part of adenine triphosphate, so it can be used to synthesize ATP. And because adenine is because it synthesizes ATP, it can increase the shelf life of RBC to 42 days. Why do we add citrate? Citrate, it prevents the coagulation by chelating calcium, and sodium diphosphate, it maintains the optimum pH.